Good afternoon, everyone. Welcome to today's session brought to you by the Transformation Office as part of our Equality Promotion and Social Inclusion project. We're trying to, through this project, look into certain issues of discrimination, human rights violations, and so forth. And today we're looking at mental health, and it is one of the bases where discrimination may manifest. So I'm looking forward to today's session. I'm looking forward to learning a lot. And I think everybody needs a mental health check now and again. So today with us, we have Ms. Nomalungelo Tokwana, and she is the director of Mtonjeni Student Wellness. I'll just read her bio before handing over to her to take us through today's seminar. So Ms. Tokwana is a psychologist and the director of Mtonjeni Student Wellness, as I mentioned. She joined the university in 2005 and was employed permanently as a counseling psychologist in 2008. In 2011, she was appointed as a senior psychologist and formed part of the student counseling psychologist management team. Her role included site coordination, supervision of intern counseling psychologists, and career core competence coordination. With the latter, she worked closely with industry and schools and built good relations, focusing on community engagements around career outreach programs and contributing towards access to university. She also joined in the university in terms of the Department of Education, where she was the head of department and formed part of the school senior management team. She's also a registered counseling psychologist with the Health Professions Council of Southern Africa, and served as the National Executive Management Committee of Southern Africa Association for Counseling and Development in Higher Education, and was the Eastern Cape Regional Chairperson there. Ms. Tokwana also attended and presented papers and also participated in workshops at international and national conferences. She obtained a level 2 peer help training of trainers, international and national certificate, and she's currently pursuing her PhD, and her study focuses on exploring the role of mindfulness and adaptability of first-year students, university students at that. And in terms of her current role as the director of Mtonjeni, she provides a strategic direction and leadership, as well as manages the student wellness programs in support of the university's vision, mission, and strategic goals. So thank you so much, Maman Kokwana. I'll hand over to you now to take us through your presentation.
Thank you so much, Adelaide, for presenting me so well. And I'm looking at time, and it's 8 minutes past 12. So I just want to share the screen. Can we all see?
Yes, we can see.
Okay. I'm just putting on a slideshow. Yeah, thank you for the opportunity to present this session. And I think it's the topic that resonates with me. So I'm hoping that we will engage towards the end. So today's session is about mental health and well-being at work. And the focus is on stigma, discrimination, and how can we promote equality. I want to start by this sentence to say workplaces that promote mental health and support people with mental disorders are more likely to reduce absenteeism, they increase productivity, and also increase quality of service delivery. So it will be important for us to define what mental illness is, because sometimes we don't really capture the concept correctly. And sometimes it's referred as an illness, and yet it is a reaction to emotional distress, and it's unlike a physical or sensory impairment. But many people think that the physical or sensory impairment, it's one that is referred as a disability, whilst mental health problems are often disregarded because you cannot see the mental health problems, so they're not visible. So you might be around a person that suffers from depression, but you might not pick up that that person is suffering because you can't see, it's not visible. And if you have a mental health condition that has a serious impact on your daily life, maybe over a long period, even for a short period, then your mental health might be considered as a disability, particularly if it's impacting on your daily life activities and it's been for a long period. So I thought it is appropriate for me to start with the World Health Organization's response to mental health. And we all know that before 2020, with some of the illnesses, so it was business as unusual because of the pandemic. But before 2020, mental disorders were leading causes of the global health-related burden. And depression and anxiety are the mostly prevalent one and leading contributors to the burden. That is experienced by families, experienced by individuals, even experienced by organizations. And the emergence of the COVID-19 has created an environment where many determinants of poor mental health were prevalent. So in terms of the global policy, the global plan of action on workers' mental health, the action plan that is tabled between 2013 up to 2030, it outlines relevant principles, relevant objectives, and implementation strategies to promote good mental health, particularly in the workplace. So it recognizes that every person with a disability has a right to work and should be treated equally and not be discriminated against, and should be provided with support in the workplace. We will have time for questions. So a person, anyone would like me to stop, maybe to expatiate or maybe explain more, then I'm willing to stop. So what are the barriers for people not disclosing their condition? As I've indicated, that it's sometimes difficult to even pick up if a person, a colleague, a staff member is really experiencing mental health issues because they're not visible. But what are the barriers for people not to disclose? It's a fear of stigma and discrimination because people fear to be judged. If you ask a question, why are we afraid to tell people who we are? Because mental conditions, they make up who we are. So it's the fear of stigma and discrimination. It's a fear of losing a career. I think that one is important. And also not being aware that they need help, because some people, they don't even become aware that they need help. They don't even understand what they're grappling at, what they're suffering with, because it's not even diagnosed. Sometimes they do not think they need help. So if we can look at the stats globally, it is estimated that in terms of the World Health Organization, that 264 million people globally, they suffer from depression, which is one of the leading causes of disability, with many of them actually being comorbid with anxiety. And there's a list of mental health conditions. I'm just mentioning these two. And in terms of the global statistics, 1 in 4 people are affected by mental health problems or illnesses. And depression is one of them, anxiety is one of them. And based on those stats, 40% of them, it's been tabled that they don't seek help because sometimes they don't understand if they're grappling with the illness, or maybe they fear to be judged. They fear stigma. And 80% of them feel overwhelmed by their responsibilities. Sometimes they blame themselves as the guilt they don't understand. And 50% have been so anxious to even disclose, and they grapple at work, maybe due to issues of absenteeism. We can list more. And since mental illness holds the stigma, sometimes that fear is warranted, it's understandable. And the last thing anyone wants is to feel judged and looked down upon every day at work. And hence people have a fear to disclose. But what is pertinent and pivotal for the organization, for departments, for companies, it is therefore essential that workplaces promote employee well-being and placing mental health at the top of the agenda so that we can be encouraging, we can be removing the barriers to stigma and discrimination. So defining mental health, what is mental illness? What is mental health conditions that we're referring to? According to the Mental Health Care Act, mental health is defined as the illness that has a positive diagnosis, because for you to be recognized or acknowledge that you are suffering from a mental condition, you need to have a diagnosis of a mental health related illness. And then that diagnosis is supposed to meet the criteria according to the DSM-5 criteria. So the Employment Equity Acts also try to define what is mental impairment, what is mental health illness, and they refer to it as mental impairment. And according to the Employment Equity Act, they define mental impairment as recognized condition of illness that affects a person's thought processes, judgment, how you see the situations, how you think every time, your thoughts, how you express your emotions, because mental illness is due to how we express and interpret emotions. So according to the Health Professional Council, for a person to meet the criteria for any mental illness, you require to be diagnosed by a mental health care practitioner, and that will be referred to the diagnosis book. So what are the different perspectives that people might have in terms of their mental health problems? And for me, I just want to highlight that there's no reason that a person living with a mental illness cannot properly manage their condition, because some of them, they have appropriate coping resources. So you'll find that not everyone with a mental health condition will really warrant or need much support, because they might draw from themselves appropriate coping measures, appropriate coping resources that they can use, and that can contribute for them to work successfully in whatever field they are otherwise qualified for. So even if they have the conditions, they don't even need to be diagnosed at time, because they draw in the coping measures, the appropriate coping resources to manage the condition and to live with the condition. However, some employees still remain hesitant to disclose. And we do understand, as I've listed before, that they don't want to disclose because they fear to be judged. So, and that deprives them of getting support because they fear of being stigmatized. I want to highlight that it is important that it starts with you as a person that is experiencing a mental condition. emotional distress that you disclose, but the question is why? Why would you disclose? What is it that you need? What is it that you want to achieve? But self-regard is important because we are treated in terms of how we portray ourselves, the image that we create about ourselves, how we come across people. So no one can make you inferior without your consent. That's a quote, open and close quotes from Eleanor Roosevelt. So the ability to look at and understand yourself, respecting yourself, accepting yourself in terms of your positive and negative aspects of who you are, with all the limitations and possibilities, you have to have self-regard. So you know yourself better. So for me, it starts with the employee or the staff member, himself or herself, to make sure that if you require appropriate treatment, you require support, you require accommodations in terms of your condition, you have to have self-regard. Self-regard will imply that you disclose, but you disclose for the reasons that you get support or for the reasons that you want to achieve. So what are the barriers? As I've indicated, that it's fear of being judged, the stigma, the discrimination, and yet no one should have withhold critical medical information, especially from people that you interact with daily, especially in the work environment, because you fear being discriminated against. Even more so, more importantly, when one is suffering from a mental illness and you do not disclose to your line manager, to your HOD, to your supervisor, it can be difficult for them, your colleagues, your line manager, to support and accommodate you. So what is important then? How do we encourage workers to disclose from those fear of being discriminated and stigma? It may be important that we develop effective interventions so that we can start addressing the workplace stigma, and we can ask questions in terms of checking and working from a strength-based approach instead of focusing on what is lacking, just to use others that have disclosed, just to have questions to say what proportion of workers experiencing mental health issues disclose their mental issues to their line managers. So even if it's a quick survey that a person can do, because we can learn from each other. We can learn from each department, from a unit, from a faculty, or from a company, from an organization, to learn what proportion of workers that manage to disclose and what are the factors did they identify with that contributed to their disclosure decision? What prompted, what encouraged them actually to be able to disclose? And also checking what were the consequences of their disclosure decision. Were there positive results? Were there negative? How did colleague respond to their disclosure? How the line manager responded to that? So there is still much to be done around mental health. So in terms of breaking the stigma, how do we do that? Is to have meaningful conversation, courageous conversations that can help people to feel less alone, because the reason they disclose is because maybe they might need support. And when dealing with a mental health issue, we have to be sensitive. Hence, the meaningful conversations are needed, and be sensitive how we handle that. So as staff members and colleagues, it is imperative that we put each other's well-being at the heart of what we do, and with safety and duty of care and the core of our institutional values. And we can name the few. Ubuntu is one of them. So it is really imperative that we live our values and apply them. And how do we continue promoting staff well-being? Based on the World Economic Forum, they highlight steps that the organization can take to create a healthy workplace. which includes awareness of the workplace environment and how it can be adapted, because the work environment might not be conducive enough to accommodate maybe people with mental health conditions, and they different in terms of how they present with. Some may be low risk, some may be medium risk, and some may be high risk, where maybe they would need hospitalization, where they will need to be out of work maybe, and it means there's a diagnosis that is needed from there, and also maybe referral to appropriate resources. So the workplace needs to adapt to promote better mental health for different employees as they present with their cases in a unique way. And also we can learn from other organizations, benchmarking with other organizations who have taken actions in terms of prioritizing mental health issues and in terms of how they respond to the staff, to the employees. So without even reinventing the wheels, just being aware of what other organizations who have taken action have done, and try to focus on the context and apply that. Also, it is important that to understand that opportunities and needs of individual employees are important and different. So by developing better policies for workplace mental health, I know that in our institution, there is a policy that is being developed for mental health workers, for mental health, particularly focusing on employees. So the awareness of sources of support is also important, where people can know where to find help, because sometimes they don't have policies, organizational policies as well. And also to be able to identify when a staff member or an employee is in a distress mode. When you can notice and identify that there's a change, yes, you don't jump, but you do that in a caring and accepting, in a non-judgmental manner. And other people might not know how to cope with the distressing or emotional distressing situation, or with a mental illness condition. So they might use psychoactive substances and provide resources to manage them. That is important. And also to continue informing staff of the available support. So to look at the resources that are available and also inform staff, continue to inform them. Involving them in decision making, so you don't decide for them and start referring them, but check with them. Hence, I'm saying it's handled in a sensitive manner, conveying a feeling of control and participation, because once they feel engaged and feel that they're part of the decision, whatever condition they're finding themselves, then they are encouraged to seek help. So the organizational practices that support the healthy work-life balance as well. So it's important to also focus on intervention processes that would promote self-care and healthy work-life balance, so to avoid burnout. And also programs for career development of employees, because maybe the condition might not be conducive now for the kind of work environment. So an employee might need maybe to look at other careers, but that should be done in a caring and accepting manner. So mental health interventions should be delivered as an integrated and well-being strategies that will cover prevention. There should be programs for proactive and prevention programs that the organization can run, and also the early identification, as I've indicated before, that once you notice change and you can identify that, because the staff members that are in your department or organizations, but once you've noticed that there's a change here And also in terms of the quality of the service delivery. If a person has been working so well and now you notice some changes, so as a line manager or as a supervisor, you have to talk to the staff member, but in a caring and sensitive way, in a non-judgmental way. I want to re-emphasize that. And once the condition has been diagnosed, and then true support, continuous support is needed, and rehabilitation when there's a need. And then occupational health services or professionals may support organizations as well, because with the occupational health, and also they can provide directives and provide support in terms of what kind of work, if now the risk is high, what kind of work the employee can be doing going in future whilst the employee is recovering. A number of changes can be made that can protect and promote mental health. So that's very important. Staff in your department, remember that they are a backbone of your service delivery. They're very important, and without them, the impact could be significant. Hence, now they need to be handled with care. You provide support, and you don't promise and over-promise what is not being able to be delivered, but you're authentic in whatever you do. Looking after their mental well-being is extremely important so that you can boost the staff morale and staff retention as well. And then outlining the task and activities that needs to be taken and where they can go for advice. And I think I've touched on this. And wellness. I think we used to have wellness at work. We might be even using another term. So wellness is more than the absence of illness. So we have to take well of our health, even if we're not diagnosed. It is a positive approach to living. It focuses on enhancing the quality of life. And if you can find work-life balance, then it means you're looking well into your wellness dimensions. And so you can begin your wellness journey anytime you change your lifestyle, as I've indicated, that it starts with you. So if you can indicate your need and try and change the lifestyle, one can improve. So if you will look at all the 8 wellness dimensions, you can see whether it's your emotional side that needs to be supported, financial, social. So all those 8 wellness dimensions are important. So when you change your lifestyle, you have to touch base on all of them. And in addition, also in support in terms of the resources that are available. So the organization, the unit, the company can provide staff with appropriate referral resources where they can get some help. Thank you. Let me end there. Karamo, I think I've...
Okay, thank you so much, Mama Tlokwana. I was very concerned when we started our session because I looked at the number of participants and I thought,
Yes.
oh no, we're so few in this room and this is such an important aspect of life, especially in society now. You've mentioned pre the pandemic how mental health and mental illness was such a big problem for us globally. So I was very worried because I thought now with low attendance, how do we really engage? But now I see we have a very strong attendance in the room. So I think our engagement now going forward will be quite rich. But I think a question from my side, Mama Tlokwana, is when you had the slide that spoke about promoting well-being, you had quite a number of aspects there on how that can be done in terms of an organization or a company and so forth. My question is then, in terms of the institution, our institution now, Where do you think we are in terms of promoting well-being or advocating for it, or promoting employees to come forward and know that they will not be discriminated against, and that it's okay to come forward with these issues? Where are we right now? And are there things that we need to do differently, or we need to do more of or less of? Where are we? What can we do?
I cannot say we did enough, but I think we're trying, because with several departments, your department, transformation department, and also HR, with all the policies that are in place in our institution. And I'm also impressed with the fact that there is a mental health policy that is being developed, and I'm part of that, actually, of the team. So I'm very much aware of that. And for us, having that will really spell clearly what needs to happen, how employees, how staff members can be treated fairly, because it is enshrined in our in our constitution and the Bill of Rights that human dignity should prevail in every department. So I should think, yes, the university, in even starting from our vision, mission, and also having the integrated approach in terms of service delivery. So I should think we're in the right direction, but I'm sure we're getting there. I can't say we 100%, because some of the policies they've just developed now.
Thank you so much for that. I definitely do agree, and I think M20 is trying its best to bring awareness to a lot of these issues, which I think is particularly difficult because in the African community, especially, to acknowledge mental health or mental illness is been quite controversial. So I think definitely such interventions are important to foster that esteem, to come forward and to have this engagement and these conversations. I don't know if we have.
Yes, definitely. Sorry, Adelaide. Yes, definitely. And remember, for us, Mtonjeni, we student focus, but we do assist the university because it's an integrated approach. So we involved in some of the policies that are being developed, especially for the safety of students and safety of everyone that will be on campus or maybe part of the campus. So I must emphasize that we student focus, but we also part of the institutional body that contributes in terms of creating a positive environment, creating a safe space. Thank you for that, but I think you wanted to ask a question.
No, I just wanted to have one last question because I am waiting for raised hands. I think maybe some of our
Yes.
colleagues are still shy. So I'll just ask if for example, I'll give, let's say, I think maybe I'm struggling with a particular issue, which maybe I think is a mental health issue. What would you advise that one would do in that situation as an employee? In that situation, do you go straight to your line manager and disclose that, or what are the steps that you can follow in terms of the institution to get help in terms of a particular mental health issue?
Yeah, it's quite a sensitive and pertinent issue because, I mean, in terms of the Health Professionals Council, confidentiality has to be maintained. So that's very important that whoever you think you can disclose, they need to maintain confidentiality. And also the reasoning behind disclosing, because I think for me, the question would be why you think it's important for you to inform your line manager. It's important because you need support and need to be accommodated. But if you are still feeling you're not sure what you're grappling with, seeking professional help will be the first port of call so that you can understand what you are suffering from or what is the condition so that the appropriate treatment plan can be delivered for you.
Thank you.
And I
Thank you
think I
so
would
much.
like also to encourage even our participants, our participants to just participate. And I think there are some conversations on the chat, so they can make comments or add from what I'm also trying to share.
I think we have a raised hand there, Siposetu.
3 of them, actually.
Oh,
Good afternoon. Okay, good afternoon, Molo Mamuno Malungelo, and to the rest of the colleagues. Maybe you did touch on this, Mamuno Malungelo, but I'd just like to know, in terms of mental health, is it what, according to your understanding, are the major contributing causes of mental health, more especially when you intertwine it with the workplace? And also, we know that sorry to those who do not understand this course, we understand that illnesses such as your flu, such as your COVID, there are prevention measures such as sanitizing and whatsoever. So when it comes to mental health, are there any prevention measures that you've identified perhaps to just try and decrease the chances of being a victim of the illness? Thank you.
Yeah. Thank you for your question. Adelaide, should I just answer as people ask questions? Ne? So is it appropriate
yes,
for
please,
me to
Mama.
respond immediately? All right.
Yes.
Thank you for your question. And there are so many factors that you can attribute to any development of a mental illness. It might be the death of someone that you're close to, and then from that grief and bereavement that can lead, if it's not treated, it can lead to depression. It might be the childhood experiences that are manifesting themselves now whilst you are working or maybe studying, because we're focusing on students. So there are so many factors that you can attribute to the development of a mental illness. It can be something that happens at a split of a second, and then maybe you reacted not knowing how to respond. You feel emotional distress and you feel overwhelmed. It can be due to work-related situations as well, that you feel the burnout can be one of them as well. So the list can be longer, as I've indicated, that there are so many factors that you can attribute to that. Coming to the prevention programs, yes, there are prevention programs that can be implemented by an organization, having the road shows in terms of raising awareness on mental issues, because as Adelaide have indicated that as Africans, sometimes it takes time for people to acknowledge that this is because most of the time they manifest itself as psychosomatic illnesses like persistent headaches, ulcers, high blood pressure, diabetic. I can list more that are manifesting as physical symptoms, and yet they are stress related. So running prevention programs and having a proactive approach, as I've indicated, that what the organizations need to do, that can be a preventative measure. Thank you. I can take another question. I hope I've answered you.
Yes, you did answer me, Ngosima.
We had a question from Sipelo. I think that the hand has now been put down. Do you still have a question?
And there's Tulani as well. There's another hand as well. I think 3 of them.
Yes, ma'am. Good afternoon to everyone. Well, I'm not sure if ever I'm in a good space, but I just saw this section on my emails. I'm a student, and I'm currently looking for a counseling. I'm going through a lot. As a result, now I'm in a verge of committing a suicide. I've tried to book via student portal, but it failed. So I just want to ask, where can I be assisted?
Okay, thank you for the question. You can come to Mtonjeni now, even after the session or before the end of the session. We do not book online for any emergency cases. We see them as they come. You come on campus for a mask to mask, or you can also do the virtual session, but you can contact us immediately from your respective campus. So every day we deal with emergency cases, which I think yours will need immediate attention. So you come, if you are at South, you come to Mtonjeni offices now. The online booking system is for the low risk one, because we've limited in capacity. So we're trying to do the intake sessions for students so that we can accommodate more of our students, hence the intake sessions, because sometimes they get immediate attention from those intakes. So it's the online booking system that is being delayed, but we're trying to fix that in terms of running the preventative programs where we're putting together workshops. But you come to Mtonjeni now, you'll be attended to. Thank you.
Sorry, ma'am, lastly. As I'm attending at second F, I'm currently at South now. I will be acceptable
Yes.
if I come to South.
Yeah, you can come to South.
Okay, ma'am.
If you're
Thank
at
you.
South now, you can come to South.
Thank you, ma'am.
Sure.
Okay, thank you. Then we had a question from Tulani. Then after Tulani, we acknowledge your hand, Gino. Okay, maybe let's go to Gino for now. If Tulani comes back, then we'll deal with that question.
Hi, thank you. This is a really invaluable session, so let me just express my appreciation for having this. Um, I, I see that there was a question also about like not all managers are skilled in being able to deal with situations of such sometimes very sensitive and also like very critical situations. And so I want to follow up on that because I also find myself sometimes being triggered in situations of this magnitude and sensitivity, um, in not knowing quite how to respond sometimes to team members, and then finding that relationships often become compromised within the team sort of engagements because of an inability to deal with things correctly in that moment. Is there an upskilling, like I think the other lady asked in the question, is there a mechanism or a way for us to become more aware of managing and dealing with these situations, perhaps that's available?
Thank you so much for that question. Hence, I put it as a recommendation that our line managers, HODs, supervisors, they need really to be upskilled in how they can provide support, because at times, as you have alluded to, you'll think that you're providing support and yet you're doing harm. And according to the Health Professionals Council, you do no harm. So sometimes you're trying to think you're sensitive, and yet you stepped on the spaces that you're not supposed to. So which means that there's awareness raising that needs to take place, whether it will be from HRs. Hence, I made that recommendation that staff, especially in management position, they need to be upskilled in how to handle these cases, as they are different, because some staff may be presenting with low levels of mental health challenges. Some may be presenting with medium, and the high risk would need the referral. How do you begin with that? So that's my recommendation, that staff needs to be upskilled, being aware of the resources that you can refer to, and also checking with the actual staff member how would they want you to support them? And because of the fears that I've listed, and even maybe from colleagues, because at times, once you have such a staff member, you find that others will feel burdened by taking over the work of a staff member that is ill. So there needs to be courageous, open discussions, but on how to go about in doing so, it requires really some training. Thanks, Gino.
Thank you. I think that then answers Kim's question in the chat that says, if your line manager is supposed to support you, are there measures in place to help them upskilled or trained in order to deal with challenges? Not everyone has skills to sensitively with people to identify sensitively with people's challenges. So I think then that then also deals with that question.
Yes, because you need to be able to identify, you need to be able to observe if there are any changes before any problem can escalate to a serious problem. So the upskilling will need that as a line manager, you are able to identify and see whether there are changes that you've noticed, maybe absenteeism that is so much, and yet maybe the staff member wasn't like that before. And also you can notice some behaviors, where the quality of the service is not as you used to. So now it's about checking instead of judging and finding that maybe this person is lazy. But what is important is to check what could be the reasons, what have changed, from this person. Thank you.
Thank you so much for that, Mama. I think that really puts things into perspective for us here. We have another raised hand there. Claudine, go ahead.
You muted, Claudine. There's also a PUM.
Can you hear me?
Yes, I can.
Okay. Good morning, everyone. Good morning, Madam Speaker. I have two issues that I would like to raise. I don't know, please help me with regards to just speaking about the first issue that I have as a contract worker. My concern comes from the fact that one is being employed in the institution as a contract worker. Almost sounds as if it's indefinitely, and there is actually no prospect in the near future, in spite of one's recurrent applications, or it is not even a feedback in terms of why you're not the ideal candidate for the position. And what also worries me in the position is also the fact that one is given sometimes a very large workload, sometimes more than or even equivalent to those that are permanent workers. So that in itself is also a stressor. You're a hard worker, you're motivated, and it's just there are no perks, there are no benefits, and being in the department, you do try and have a good output. I don't actually see any option or even an ideal person that one can go to and basically speak about these kind of stresses, because you know you try and uphold a certain work ethic, also with the hope that your managers would recognize it and somehow motivate for you for permanent employment. But there is absolutely nothing that comes to the fore. And that being said, it does also affect one's relationship with your colleagues, because even when certain activities and tasks are being allocated you can see that there is a definite distinction between what is meant for a contract worker and that of the permanent worker. That is my one issue. The second one is being in contact with students from a first year level and having like maximum contact of almost over 3 days per week. I am really concerned about students that highlight that they do have psychological stresses, whether it is teaching and learning related or whether it is, coming from home prior to them registering for the course. I am really concerned because at the moment, like one of the previous speakers was saying, the student support and counseling maybe was not available, or it was the waiting list was too long, etc. So I am really concerned as to what other forms and methods can be made available, really, to say that students can be seen to ASAP. I am very, very concerned about that.
All right. Thank you. Thank you for your questions. Your number one question, I might not be able to give appropriate answer, a definite answer for that, but raising a question back to you is to say, did you discuss your concerns? Because it's when we raise our concerns, we get a listening ear. So that's very important that we raise our concerns and we discuss them within our spaces, because it's within your department. As I have alluded to the fact that some of the mental health issues and conditions are attributed to the work environment as well, where we have to discuss these pertinent issues with colleagues, with people that we worked with, and to display and express our dissatisfaction or our concerns. So that I'm throwing it back to you to say, please try and reach out to people in your department, especially the supervisor, line manager, or HOD. And coming to your second question, which is important, and its focus is really to my work, that one, because I'm a director of Mtonjeni, so I'm focusing on students. We do send memos monthly to explain the processes and procedures on how to access our services. And then we provide external resources as well, where students, whilst on waiting list, they can speak to higher help. I think if you saw the last slide that I provided, the slide there, it includes everything in terms of the external resources that students can also attend to. Now we also put preventative measures like the group therapy. We're putting workshops together. Yesterday, there was a workshop on emotional dealings with every challenges that students are experiencing. So there will be other ones that will be facilitated as well, so that we can accommodate those students that are still on waiting list. And we do scan through the level of risk. For emergencies, they are attended every day immediately across all 5 campuses that we have. So the waiting list is there, but we do try and attend to them.
Thank you so much.
Yeah, thanks.
Yes, I appreciate it.
Okay, we have about 4 minutes before we close. So I'll just quickly read a question in the chat before we get to a Piwe. Hopefully yours will be quite a short question. Okay, so we have a comment there, or question from Mohali that says, kindly advise on how we can support symptoms of mental illness in a person. What are the symptoms? And then we have a comment from Tulani in the chat that says, please let's assist on medication if we can gather more. New gums or reduction meds for student well-being students. Then it will be easy for us all at the coaching towards students. So that's what we have in the chat. I don't know, Mama, if you want to go to our PWare there and then just deal with that all at the end.
Yeah, let me just respond now in terms of the symptoms they're presenting with. They will be different. For example, if I can list a few, you'll find that there's fatigue. If we're referring maybe to other depressive symptoms, even if a person doesn't meet the criteria for depression, the person might be presenting with depressive symptoms, or maybe anxiety symptoms where you have the anxiety attacks or panic attacks, and others might be manifesting as physical illnesses, stomach cramps, persistent headaches, and then also the loss of appetite. The list is long. There are so many symptoms, but if people can do themselves a favor just to check and to talk to someone, because Higher Health is having psychologists and counselors that will attend and contain for containment, and then they can come to us. After hours, they can contact them. And the second question was on medication. Yes, we do refer students for medication, but the process also takes longer in terms of before they can be given appropriate pharmacology. They need to go through a process. There are blood tests that needs to be conducted. And only then, once they bring those results, the psychiatric unit at the provincial will be able to give them medication. Yeah, I think I've answered that one.
Okay, then PWare, very quickly, your question.
Okay, thank you, Adelaide. I think I'm audible. Mine is not a question, it's just a comment, is to give thanks to the speaker for opening the space. It's a very conducive space, and I think we should have more of these type of programs, because as the speaker has said, that Mtonjeni is all about wellness of students. Now it's reinvented and brought to us as workers of the university to open the space, and I thank that a lot. Thank you.
Thank you so much. There are two hands.
Are there two hands? I think they're old hands, Mama, because it's
okay.
PWare and then Claudine there, so they're old hands. And then I don't think there's anything else left out there in the chat. I think I read them all. Okay, there's a last, I don't know if it's a question or comment, but then it just says, good afternoon, everyone. Just a comment. I'm not sure how to share my experiences, but I've realized that physical health cannot exist without mental health, because dealing with withdrawal or isolation from others is difficult. I believe this platform is extremely beneficial, and having participated in it, I now have some guidelines to share with other team members in creating a safe environment. Okay, so it's a comment.
Thank you for that. Thank you, Gino, as well. I saw yours.
All right, I think we can then bring our session to a close. Thank you so much, Mama Lungelo, for taking this time out. We have seen, just based on the engagement and the numbers that attended today, that this conversation was needed. So we will definitely collaborate more in having these types of conversations going forward to see what we can do, because advocacy, I don't believe, is a one-stop shop or it's a one-day job. It's continuous. So thank you so much, Mama. Thank you so much to everyone who has taken time to participate, to join, to just listen in. Thank you so much, and may you continue to spread the word and have this element of care and empathy with others as we leave. So thank you so much, and good afternoon to everyone.
Yes, thank you. Bye to everyone.